Good morning, everybody. My name is Jason Sees. I am the Deputy Chief Executive at Hillingdon Hospitals, and I am the SRO, which is sort of a shorthand for Senior Responsible Officer for the new Hillingdon Hospital. Welcome today on a very foggy and frosty day to our webinar on our new Hillingdon Hospital. What we want to do today is just update you since the last time we met on particularly some of the clinical developments and how our clinical planning of our new hospital is going. So to recap, what we went through last time is for the new Hillingdon Hospital, it's a three-stage process that we're going through for our business case development. So to build a new business case, there's three stages. There is a strategic outline case, an outline business case, and a full business case. We've completed a strategic outline case, and that has been approved by all our partners at the centre in terms of regulators. We are very much now developing our outline business case in partnership across our local health economy in Hillingdon, but also as an integrated care system. So that's the North West London integrated care system, and very much also working with colleagues in London and nationally. So very exciting time for the hospital. The outline business case is making really good progress, and is summarised on the slide that hopefully you can all see, just about some of the key headlines about why we need to improve our hospital. So as we've sort of touched on, we've highlighted in previous webinars that there are a number of building issues that mean a new hospital is essential for us. There's quite a stark figure there. 81% of the hospital buildings that we currently have on the Hillingdon Hospital require major repair or replacement. And again, for people who have used Hillingdon Hospital, the current configuration of our buildings and services is very much like a maze, as services have sort of developed over time. And so what we're very much looking to do now is to redevelop our site and improve the physical building. So we may need to make sure that the building is the right size. Sorry, we need to go back one, just a second. And we are sort of very much working through about all the sort of key bits about how that will work. Joining me today is Mel, one of our health planners, and hopefully I'll get your name right, Richard, who's one of our paediatric consultants. Thank you, Richard. And what we just want to do is, for an outline business case, just talk you through then about how we're planning the size of the hospital, some of the service improvements, but very much today just to focus on some of our clinical developments and from a patient perspective, just about how we want to transform our services in sort of anticipation of providing new models of care in the new hospital. So I shall pause there and hand over to Mel, and hopefully through the modern world of technology this will all work now. So hello, Mel.
Hello, thank you, Jason. So to right size the hospital, we look at a number of factors. We look at the data from the Office of National Statistics, and the latest data is from March 2020, that helps us project the activity into the next decade. And we can look at that slightly beyond, but for the moment we're looking at the next decade. For that, we're looking also at the changes within our local population. So we know there may be local planning policies, so we'll apply that too. The data that we look at, we've broken down by age groups so that we can tailor that to the different areas of the hospital. But whilst we also look at that, we also consider how we want to treat people in the future. So this is not just providing what we currently do, but considering how we can work with our integrated care partners, so the local community and beyond, as Jason mentioned, to provide an improved model of care for our residents. So we can go to the next slide, please. So for this, I think we've mentioned in a previous webinar, we've got a number of working groups that work with the clinical cabinet, and Richard will take you through what some of the outputs of some of these working groups have developed with their models of care and their future visions. Don't think I can't hear you, Richard.
Richard, can you hear me now? I'm back. Excellent. So thank you, Mel, and thank you, Jason. As Jason said, I'm one of the consultant paediatricians at Hillingdon and part of this clinical cabinet working group. And really what we are trying to do is to plan for a new hospital that fills certain key principles, which will probably sound pretty obvious to many of you. So fundamentally providing a much better environment for patients, and with that providing better care for patients. We also want to look at how patients flow through the hospital, and there's nothing like a pandemic to make us really focus on how infection control plays out in all of that. We want to make it fit for the future, and that means making it fit for future digital practices and new technologies, and making it future proof so that we can embrace those new technologies in helping us care for patients, and finally making it green and sustainable. And that's a huge challenge, but it's also hugely exciting. So I want to just take you through some of the specifics of things that we're trying to achieve with this new hospital. So firstly, for many of you who visited the hospital or been in the hospital as a patient, you'll know that some of the wards, particularly some of the really old ones, have those typical what we used to call the Nightingale wards with lots of beds. So some of them have 10-bedded wards and quite a small proportion of single rooms. And we know from patient feedback that there are a large number of patients who would prefer to be in private rooms, and also for infection control reasons need to be in single rooms. So one of the things that we're aiming for is smaller bedded bays, so 4-bedded bays, which fit better with infection control procedures, but also a larger proportion of single rooms. And you might ask, well, why don't you just have all single rooms in the hospital? Because clearly, you know, that's what people want. But actually, not everybody does want to be in a single room, and also we have to balance having single rooms with actually fitting the number of beds that we need in the hospital in the space that we've got, and also making it really work well for the nursing staff looking after those patients. So we're trying to get a balance of all of that. With maternity and paediatrics, there are different issues. Oh, can we just go back? So with paediatrics, a lot of children, a larger proportion of children come in with infectious issues which need to be nursed in single rooms. So that's one of the reasons why paediatrics will have a greater proportion of single rooms, and also maternity. We know that it provides a better experience for new mothers. Critical care will also have 60% single rooms, which is much greater than we have now. And this mix helps to support patient choice, but also to make sure that we can provide the best nursing care for those patients. So next slide, please. So I'm just going to take you through some of the individual departments now. So there are huge amounts of thought gone into how we plan our urgent and emergency care floor. And this is the front door of the hospital. This is where most of the patients, or many patients, come in. And what we're trying to do is to improve our flows through this centre to make patients who are coming in needing emergency care, make their care as seamless and efficient as possible. And that means having certain things co-located in the same place. So having our specialties are able to access the resuscitation areas quickly, having things like CT scans and x-rays close by to the emergency department will all help us to look after patients more efficiently, and hopefully for them to have a much quicker trip through our department. The other thing that would be really useful with having a separate X-ray and CT area in the emergency department is that if we're thinking about future pandemics, we also need to be able to separate flows of patients who might be infectious from those who might not be. So we're really thinking ahead about all sorts of possibilities when we're planning the layout of this new hospital. Next slide. Great. And then elective care means care that's generally planned for, and these are just some examples of some of the things that we hope will provide better care for patients. So things like multifunctional treatment rooms and large flexible spaces. So for example, some of our more elderly patients need rehabilitation, and so having a proper gym space where physiotherapists can do proper therapies for them will help. We want specific areas for day case procedures, and all of this is aimed at enabling patients to be seen more quickly and more efficiently and in a better environment, and hopefully to prevent unnecessary admissions, so to be able to treat more patients as day cases and having less stay in overnight, which we know is what patients want, as well as being more efficient for our health service. Next slide, please. Thank you. So again, with maternity, there are lots and lots of improvements planned to make the birthing experience much better for women and their families. And just one small example is having a midwifery-led unit, which is near the labour ward, so that if the mum and baby need extra help, that help is readily available and is on site. But it also means that women can give birth in an environment that's much more home from home, which we know is what women want. And a lot of this work has come through public consultation. There's a lot of research around this sort of environment that patients want to be cared in. Next slide, please. So I talked earlier about one of our key principles being that we want to make this hospital fit for the future, because it's taken us an awfully long time to get to this point. So I started at Hillingdon about 12 or 13 years ago, and I remember meeting the chief executive then showing me plans of a potential new build. And so we've known for a long time that the estate at Hillingdon needs improvement. And it's so exciting to be finally in this position where we can see that it's hopefully becoming a reality. So we've got to make sure we're not going to get another hospital in the next 50 years. We need to make sure that this hospital is fit for purpose and fit for the future. So one of the key elements of our planning is how digital technology can help us to look after patients more efficiently, how it can help people find their way around the hospital to appointments. Hopefully a lot more care will be able to be done virtually. That's something that we've learned through this pandemic, that we can make changes and we can improve care very quickly when we need to. So we need to also be able to make sure that this new hospital is future proof, that it can cope with the rapidly moving field of technology and digital advances. So we've got a really great digital team that are involved in every stage of the planning. Next slide, please. So one of the other elements that has really been very important in our dealing with the pandemic is how we use our critical care and our critical care capacity, so how many beds we have, and being able to be flexible with that when we have surges in demand. So one of the really exciting changes that's planned is a medical high dependency unit. So a high dependency unit is a sort of not quite intensive care, but you can still look after really sick patients there. So having that next to the critical care unit will mean that we can flex up and down as we need to. So it can easily be converted into additional critical care beds if needed, but when it's not needed, it can be a high dependency unit. And that will be fantastic, again, for situations like this, or even in winters where we see an increase in the number of patients needing critical care. It means that patients who are in the high dependency unit and who then deteriorate and need intensive care can move to that area seamlessly, because it'll be right next door. They won't be having to travel halfway across the hospital, and we know that that's safer for patients. And last but definitely not least, so this is the bit that I'm the most interested in, obviously, is what we're going to be doing for children and young people. So one of the groups of people who we feel have been a little bit neglected in healthcare are the adolescents or young people. And traditionally, they've sort of been lumped in with the paediatric departments, but we know that from what they tell us and from lots and lots of research and evidence out there, that young people have their very own special needs in that they want spaces that are appropriate for them. They don't necessarily want to be in a ward filled with cartoon characters. They want an environment that's appropriate for them. They want private space. They want ability to have some independence, for example, to be able to make themselves a cup of tea or coffee, and to be able to have space where they can carry on with their education while they're in hospital. We have a lot of complex patients at Hillingdon, and some of those patients end up staying in hospital for quite a long time. So we need to be able to make sure that they don't lose out on their education while they're in. They need to be able to connect with their friends so they don't feel socially isolated. Some of these patients have chronic conditions, which mean that they can be socially isolated. So we're doing a lot of work in trying to create a specific space for adolescents. We also want to make sure that the spaces where we look after children and young people in the emergency department is really fit for those families, and knowing that particularly in the resuscitation areas, it can be really stressful for families. So we want to make the space helpful to us to look after these patients in the least stressful way possible. And finally, we want to use our digital advances to be able to look after more children at home and keep them at home without them actually needing to be in the hospital. And we're already making advances towards doing this. So I think having a new build will really help us to make care for children and young people in Hillingdon a gold standard and something that we can be really proud of. So that's a quick run through of the elements of planning that has been going on, and I know that we're going to have an awful lot more to share as the plans become clearer, which will hopefully make it seem even more exciting. But for now, I'm going to open the floor to questions, and I think one of you are going to field the questions.
Yeah, that's fine. Thank you very much, everybody. So there is, you should be able to see a question bar at the side. If you'd like to sort of ask any questions, please just pop them in there and we will get through as many as we can. First couple of questions I'm going to send over to Jason. Jason, there's a question on whether the SOC has been finalised.
Hopefully you can hear me again. Thank you. So in terms of the strategic outline case, that was approved by the Hillingdon Hospitals Trust Board this year. And then we submitted that to our sort of two main regulator colleagues at the centre. So there's NHS England and Improvement, and there is the Department of Health and Social Care. Those two organisations come together in something called a joint investment committee. And so we presented the strategic outline case to the joint investment committee a few months back now, and resulting from that, the strategic outline case was approved. As with all of these things, it's then sort of written up. There's bits that need further work. And that's always expected. And for us, it's very much the detail that comes with developing an outline business case. So a strategic outline case is, by definition, quite high level. The outline business case pretty much is where all the details done in terms of developing the plans for the new hospital. So I think, as we previously discussed, it's almost like when you have an extension done on your house and the architect or whoever's come around with the builders, they have quite detailed drawings about where everything's going. So if you're having a living room, where your plug points are, where your doors are, and how it all works. And again, if you were having a bathroom extension where all the piping and everything else goes, that's very much the detail that's required in the outline business case. And so in line with expectations, that's everything that will be sort of developed over the next few months. Re the strategic outline case, there was a piece I still need to follow up because we're still requiring final clarification. We have asked colleagues that can we publish our full strategic outline case, and we were just waiting for final confirmation from the Department of Health and Social Care that we could do that. So I will update that on the next webinar, but that's the only reason why we haven't published the final SOC, is we were just waiting for final confirmation from colleagues at the centre. So I will chase that.
Lovely, thank you, Jason. I'm going to stay on you because I've got a couple of questions. I'm afraid we don't have colleagues from our estates team here today, but I'm going to pass those questions over to Jason for a bit. Jason, we've had a couple of questions about whether we'll have an air ambulance at the hospital, and also whether there'll be a helipad.
Thank you for that. So what Hillingdon Hospital is very much, it's an emergency and urgent care hospital. There's sort of the main way people arrive in to us is either sort of ambulatory, which is sort of a way of describing how people can sort of walk into our hospitals, and then the main sort of conveyancing that comes to us is by ambulance. There are some hospitals which have helipads, but very much the clinical model that's certainly developed over the last decade is that for helicopters, which almost by their sort of definition are taking sort of quite sick patients for urgent and emergency treatment, normally sort of requiring sort of trauma facilities. Over the last decade, certainly across London and the southeast, there has been hospitals designated as trauma centres. Although we're a busy urgent and emergency care hospital at Hillingdon, we're not a trauma centre. So helicopters sort of traditionally, certainly over the last decade or so, sort of are more focused on going to one of the trauma centres. And the planning for the new hospital is we will not have a helipad. So what was the other one?
Jason.
Another one
I was going to ask you a question about, there's lots of questions about car parking and transport, and what we will have on site. So, you know, car parking during construction, and also whether we'll look at having bus stops on site in the new development.
Thank you for that. So I'll sort of hopefully wear an honorary estates and facilities badge for sort of answers on this. What we are doing at the moment is we are sort of working closely with our partners across the local health economy in sort of developing the sort of planning sort of detail around how the new Hillingdon Hospital will look. Part of that and integral to that will be the car park and the building of a multi-storey car park. So as we sort of develop our planning application with partners at our local sort of London Borough of Hillingdon planners, a key part there will be the sort of size and the siting of the multi-storey car park. Integral with that will be in the new Hillingdon Hospital plans, really making clear how we come together as a sort of integrated transport hub. So very much about not only how we will sort of integrate into the design of the new hospital, sort of the facilities for bus stops, etc. But actually, if you look from a patient perspective, how can we really make it sort of user friendly? So we don't want people coming in on a bus and the bus stop sort of being on one area of the site that's sort of separate to where the main entrance will be. So how we can almost look to make sure that we, almost like when you go to a shopping centre, some shopping centres that you go to, you have the shops, but integrated with that, you have the car parking and a transport hub with the taxis and the local sort of bus companies. That work is in train at the moment, so part of the reason why estate and facilities colleagues aren't able to join us today is those meetings are ongoing at the moment, and so very much we hope to bring back to you over the next meetings now sort of what initial planning applications will look like for those transport facilities.
Thank you, Jason. Richard, I'm going to pass the question to you. I think you're the right person to answer this one, but please let me know if that's not the case. There's a question about whether there will be a safe area within the hospital for somebody in a mental health crisis.
Yeah, that's definitely part of the planning. So we're seeing increasing number of young people, sadly, who present in mental health crises, and also adults, obviously, as well. So part of the emergency department planning is to make sure that there are safe cubicles. So there are very specific building regulations for making sure that these spaces are safe and that people can't harm themselves. And we need those in the adult emergency department, but also the children and young people's department. And what we're hoping is that we can make those spaces flex up and down so that we can share them between the departments to make the best use of that space. I hope that answers that question.
Thank you, Richard.
Thanks, Richard. About, facilities to charge devices. And that's also very much part of the planning. We recognise that people have, they're very reliant on their phones, and actually as part of the new build and the digital sort of future, we'll be, people will be using their devices to actually help them navigate around the hospital and reminders hopefully to where their appointments are, when they are, and possibly even using them to kind of almost check in to their appointment, as some GP surgeries already do. So definitely, yes, there is planning for people to be able to charge their devices, because it will be very, these devices are very much part of our lives now. So yes, it's in there.
That's brilliant, thank you. It's saved me answering that question as well. So another question we've got, Mel, I think this might be one for you, is about whether there'll be adequate staff changing facilities to allow staff to change in and out of uniforms in a secure and efficient way. And I think that's thinking about infection control and things like that.
Yes, okay, thank you. Yes, we've certainly been talking about that, and there will be provision for staff change. Some of it may be more localised to the service, and other parts of it may be more so on the flow out of the hospital before people get to their cars or their mode of transport for leaving the hospital and accessing the hospital. So it will certainly be an increased provision from what we have today. But we're still working through how much of it is within a department versus what can be on floors or the way in or out of the hospital. I hope that answers that one.
Lovely, thank you. I'm going to put the next question to Jason. We had a question about the Mount Vernon Cancer Centre and the review going on there, and whether the review team was approached about possibly locating that in the new build. So Jason, are you able to touch on that one for me?
Yes, thank you, Sarah. So we're working closely with colleagues about the planning of the future of services at Mount Vernon. So the key piece of the sort of cancer centre currently at Mount Vernon is it's run by East and North Hertfordshire NHS Trust. So sort of as you sort of just go above us into Hertfordshire, there is a piece of work where it's now being looked at for East and North Hertfordshire NHS Trust to hand over the running of that service to another provider, and that work is currently in train. What, as part of that process, is also being looked at, so this whole process is being sort of overseen by what's called specialist commissioners. So cancer services are sort of commissioned by specialist commissioning, and so East of England specialist commissioners are running this process. So there is the first part, sort of which organisation will be running these services. There will then be sort of another piece of work following on from that, of what potentially are the options for the sort of future siting of these services. So the clinical review that's been published around the current configuration of cancer services on the Mount Vernon site is that, from a patient perspective, certainly for inpatients, it's a suboptimal model. So they will also be looking at options going forward for how can we improve the service for patients in terms of location. Yes, there'll be a number of options looked at, and we will constructively sort of enter into dialogue with all the parties concerned in exploring those options. It's sort of no different to what we had to do in our strategic outline case. So if we recall, for the strategic outline case for the new Hillingdon hospital, we had a long list of options where you sort of look at a number of things that can be done, which is then sort of worked through to a short list, so a short list of options, and then you sort of come up with that indicative preferred option at the end of the strategic outline case. That's a similar process that colleagues from East of England Specialist Commissioning will be doing with all the parties involved for the future configuration of cancer services. So in summary, absolutely, we are in active dialogue with colleagues.
Lovely, thank you, Jason. I'm aware of time, so I think we've got one more question here. Richard, I wonder whether I could send that to you. It's about virtual consultations, and just getting an idea of what level of virtual consultations will be available in the new build.
Thank you, that's a great question. So as you may know, the pandemic has kind of fast forwarded a lot of advances in how we have been working, and one of those has very much been in the field of virtual consultations. So many of the departments at Hillingdon have already been doing that through this pandemic. So initially just doing telephone consultations, and then using technology such as various applications to do video consultations. So we've seen that that can work, and that patients really like it, because they don't have to come to the hospital, they don't have to park, it seems more convenient, and a lot of work can be done like that, and that's something that we've learned through this pandemic. So the answer is yes. We will definitely be building that into our design, and we've talked about having suitable spaces for clinicians to do virtual consultations, making sure that they've got the technology around them to enable them to do that. But we also remember that as doctors, there is also definitely a role for seeing patients face to face and physically examining patients, and we need to make sure that we don't forget through this pandemic that that's a really important part of what we do too, and making sure that we've got space and facilities to do that as well. Hopefully that answers that.
Right, so I'm just, Richard, thank you very much for that, and thank you very much, Mel, as well, and thank you very much to Sarah for fielding all the questions. I think for today, hopefully we've covered all the sort of main questions asked. Very conscious of there will always be things that pop up in people's heads that maybe people weren't thinking of asking today. There is an email address and other details on our website, so if there's anything you want to raise with me or the team, please contact us through our sort of communication channels on the website. Or if there's anything else you want to find out, or just anything in terms of general queries, please get in contact. Thank you very much for joining us today. The next web event is on the 13th of January, so gosh, we'll be into 2021. So 13th of January, and I think it's in the evening, so it will be 7:30 p.m. 7:30 p.m. on the 13th of January. So very much look forward to as many of you again being able to join then, and as ever, thank you for all your support in taking forward the new hospital proposals. As Richard said, this has been spoken about and discussed, gosh, for too many years, and this is sort of a once in a sort of generation sort of opportunity for us to get a new Hillingdon hospital. It's fit for purpose, really has 21st century facilities for our staff and the patients and the local population we serve, and we very, very much want to get this built now at pace. So look forward to seeing you all again in January. Thank you very much.
Thank you.